Hello, my name is Dr. Richard Hayes. I've spent over 35 years working closely with older adults, helping them navigate the complex world of health and wellness as they age. Today, I want to share something incredibly important, something I see every day in my practice but many people don't realize: the hidden dangers of medication interactions and how they silently affect your joints and arthritis. Have you ever wondered why your arthritis pain seems to flare up even though you're taking all your prescribed medications? Or why sometimes new aches appear out of nowhere? The truth might surprise you. It could be the medications themselves interacting in ways that worsen inflammation and joint pain without you even noticing. In fact, many common drugs prescribed for blood pressure, depression, or even sleep can interact with each other or with supplements you take, and these interactions can quietly damage your joint health over time. What's worse, these effects often sneak up on you, making it hard to connect the dots. So, what can you do to protect yourself and keep your joints as healthy and pain-free as possible? In this video, I'm going to reveal the most common medication interactions that seniors face, and share practical, simple steps you can take right now to prevent these hidden threats. Whether you're already dealing with arthritis or just want to avoid it, I'll show you how to work with your healthcare providers to safely manage your medications and keep your joints moving freely for years to come. Stay with me, because your health and mobility depend on understanding this crucial information. Now, let's talk about a condition many of you might have heard of, or even struggled with, called gout. Gout is a type of arthritis that happens when tiny crystals of uric acid build up inside your joints. This buildup causes sudden, severe pain, swelling, and redness, often starting in the big toe but potentially affecting other joints too. It's painful, frustrating, and can seriously impact your quality of life. Here's the catch: some of the medications prescribed to manage other common health issues in older adults, especially certain types of diuretics, also known as water pills, can unintentionally increase your risk of developing gout. Diuretics like thiazide and loop diuretics help your body get rid of excess salt and water, which is important for controlling blood pressure and reducing swelling. But these medications can also reduce how well your kidneys eliminate uric acid from your body. When uric acid isn't cleared efficiently, it starts to build up in your bloodstream, eventually forming those painful crystals in your joints. This means that while diuretics are helping one part of your health, they might be creating trouble for your joints without you even realizing it. Many seniors taking these medications don't connect their worsening joint pain to their water pills, which makes managing gout even harder. But understanding this connection is the first step to protecting your joint health. In the upcoming parts of this series, I'll explain how you and your doctor can monitor uric acid levels and explore safer medication options or lifestyle changes that can reduce gout attacks. Together, we'll find ways to balance your medications to protect your heart, kidneys, and most importantly, your joints. Remember, knowledge is power. And managing your health smartly means fewer painful flare-ups and more freedom to enjoy your golden years. As we continue this important conversation, I want to bring your attention to another group of medications that many older adults use regularly: antidepressants and sleep aids. These medications, including common antidepressants known as SSRIs, selective serotonin reuptake inhibitors, and sleep medicines like zolpidem or trazodone can have unexpected effects on your muscles and joints. While these drugs help manage mood and improve sleep, which are both crucial for overall health, they may also cause side effects that impact your joint comfort. Some patients report muscle stiffness and joint pain after starting these medications. In some cases, the drugs can even dull your ability to feel pain properly. At first glance, that might sound like a good thing, but it can actually be dangerous. When pain signals are masked or reduced, you might not notice when your arthritis or joint inflammation is worsening. This delayed awareness can slow down the adjustments your doctor needs to make to your treatment plan. In other words, the medication might unintentionally hide symptoms that tell us your arthritis isn't under control, which could lead to more joint damage over time. Moreover, these medications might interfere with the effectiveness of arthritis treatments you're already taking. For instance, if your anti-inflammatory medications don't work as well because of these side effects, your joint pain and swelling might persist or get worse. That's why it's so important to keep your healthcare team informed about all the medications you're using, including antidepressants and sleep aids. Open communication helps us identify potential problems early, so we can tailor your treatment to protect your joints while also supporting your mental health and sleep quality. In upcoming discussions, I'll share practical tips on how to manage these medication effects safely and how lifestyle changes can complement your treatment to keep you moving comfortably. Remember, your health is a balance, and with the right knowledge, we can maintain that balance for a happier, healthier life. Now, let me address another important topic that often goes overlooked: the interaction between herbal supplements and prescription medications. Many of my patients take herbal products like turmeric, ginseng, garlic, devil's claw, or fish oil to support their health naturally. While these supplements can offer benefits, they can also influence how your body processes medications, especially in the liver, where most drugs are metabolized. For example, turmeric and ginseng are known to affect liver enzymes responsible for breaking down many prescription drugs. This interaction can either speed up or slow down medication clearance, potentially making your prescribed medications less effective or increasing their side effects. Imagine taking a medication for your arthritis, only to find it's not working as well as it should, or feeling unexpected symptoms because the drug is building up too much in your system. Another critical concern is related to blood thinning. Supplements such as garlic, fish oil, and even turmeric have mild blood thinning properties. When combined with anti-inflammatory medications like NSAIDs or corticosteroids, which are commonly prescribed for arthritis, these supplements can increase your risk of bleeding. This could mean anything from easy bruising to more serious bleeding events. Because of these risks, I always emphasize the importance of telling your healthcare provider about every supplement or herbal product you take. No matter how natural they seem, it's not just about avoiding harmful interactions. It's about safely integrating these supplements into your overall treatment plan to get the best possible outcomes for your joint health. In our next discussion, I'll guide you through how to safely incorporate herbal supplements and what signs to watch for that may indicate an interaction. With the right knowledge and careful monitoring, you can enjoy the benefits of both traditional medicine and natural therapies without compromising your health. Remember, Staying informed is your strongest defense in managing arthritis and living comfortably after 60. As I've shared so far, the world of medications and supplements can be quite complex, especially when managing a condition like arthritis. That's why I want to stress a vital point: the importance of regularly reviewing all the medications you take, whether they're prescription drugs, over-the-counter remedies, or even herbal supplements. You might be surprised to learn that many seniors unknowingly mix medications that don't work well together, which can worsen joint pain, increase inflammation, or even cause new health problems. For example, some over-the-counter pain relievers might interfere with your prescribed arthritis medications, or certain supplements could amplify side effects or reduce effectiveness. Even medications for unrelated issues, like high blood pressure or depression, can interact in ways that affect your joints or overall health. This is why I always encourage my patients to bring a complete list of every medicine and supplement they're taking, including vitamins, herbal products, and anything they buy without a prescription, to every doctor's visit. More importantly, don't hesitate to ask your pharmacist to review your medications, especially if you notice any new symptoms like unusual pain, stiffness, swelling, or even unexpected bruising or bleeding. Regular medication reviews are a simple but powerful step that can prevent serious problems before they start. They allow your healthcare team to identify and adjust potential interactions early, ensuring your treatment plan remains safe and effective. For seniors managing arthritis, this kind of vigilance can mean the difference between stable joint health and painful flare-ups. So my advice to you is this: make it a habit to check in on your medications frequently. Keep an updated medication list handy. Speak openly with your healthcare providers. And never ignore new symptoms. Your joints, and your whole body, will thank you. In the next part, I'll share practical tips on how to prepare for medication reviews and what questions you should ask your doctor or pharmacist to protect your health. One of the most challenging aspects I've observed in my years treating older adults with arthritis is how silently drug interactions can creep into our lives. Unlike a sudden allergic reaction or obvious side effect, these interactions often develop slowly over weeks or even months. Because they don't produce dramatic symptoms right away, many patients and even some healthcare providers might miss the warning signs entirely. For example, you might start to notice your joint stiffness or swelling gradually worsening despite following your treatment plan perfectly. Or perhaps your usual medications seem less effective at controlling pain, but you chalk it up to aging or increased activity. These subtle changes are often the quiet whispers of medication interactions undermining your body's ability to heal and manage inflammation. This slow progression is why vigilance is so crucial. As Dr. Richard Hayes, I always remind my patients, don't wait for a severe flare-up or a sudden, unbearable pain to seek help. Instead, pay close attention to any gradual shifts in your arthritis symptoms, even small increases in discomfort, stiffness, or decreased mobility can be early indicators that something isn't right with your medication regimen. Early recognition of these subtle changes allows us to intervene promptly, adjusting medications or supplements to prevent irreversible joint damage. Arthritis is already a challenging condition, and silent drug interactions only add fuel to the fire, making it harder to maintain your quality of life. So, my advice is simple but vital. Keep a detailed symptom journal. Note any new or worsening symptoms and share these observations openly with your healthcare team. This habit can be a powerful tool in catching hidden drug interactions before they cause lasting harm. Remember, managing arthritis effectively is not just about taking medications but understanding how they work together, or sometimes against each other, in your body. Stay proactive, stay informed, and together we can protect your joints and your well-being. In my next message, I'll discuss specific symptoms you should watch for and how to communicate them effectively to your doctor or pharmacist. As I've shared before, managing arthritis and its complications in older adults isn't just about taking a pill and hoping for the best. It requires a comprehensive, thoughtful approach, one that considers your physical health, mental well-being, and the complex interactions between medications, supplements, and your body's unique responses. After decades of working closely with seniors, I can't stress enough how essential it is to coordinate care fully and honestly with your healthcare team. First, never underestimate the importance of addressing your mental health alongside your physical symptoms. Chronic pain and joint stiffness can take a toll on your mood, energy, and motivation. Depression and anxiety are common but often overlooked in older adults with arthritis. Make sure you discuss any feelings of sadness, frustration, or fatigue with your doctor. Sometimes, adjusting your medications or incorporating gentle therapies like mindfulness, counseling, or even light exercise can profoundly improve both your joint health and overall quality of life. Second, be transparent and proactive when it comes to the medications and supplements you're using. Don't assume your doctor knows everything. Many seniors take herbal products, vitamins, or over-the-counter remedies that can interact with prescription drugs. I always encourage my patients to bring a complete list of all substances they take, including dosages, to every appointment. This open dialogue helps us identify potentially harmful combinations and adjust your treatment plan before problems arise. Another crucial piece of advice is to listen carefully to your body. Any change, no matter how subtle, in your symptoms should be noted and shared. Are your joints feeling stiffer in the morning? Is pain more persistent or spreading? Do you notice increased fatigue or muscle weakness? These clues can signal medication interactions or disease progression and should never be ignored. Remember, you are the most important member of your healthcare team. Your observations, questions, and honest conversations empower your doctors and pharmacists to tailor treatments that fit your needs safely and effectively. Together, through comprehensive care, open communication, and attentive self-awareness, we can navigate the challenges of arthritis and improve your health, comfort, and independence. In our next discussion, I'll guide you on how to prepare for medical appointments to make every visit as productive as possible. As we've explored through my story, the complexities of managing arthritis and medication interactions in older adults are often underestimated. One key lesson here is the importance of awareness of what medications and supplements you're taking, how they might interact, and how your body responds. This isn't just about avoiding side effects, it's about preserving your mobility, comfort, and quality of life as you age. Another important message is the power of communication. Whether it's with your doctor, pharmacist, or loved ones, keeping an open, honest dialogue about your health is crucial. Don't hesitate to ask questions or share concerns. Even small changes in your symptoms can be early warning signs that deserve attention. Remember, you are the expert of your own body, and your voice matters. Lastly, caring for your mental health is just as vital as caring for your joints. Chronic conditions can affect mood and motivation, but with the right support and mindset, it's possible to maintain a fulfilling, active lifestyle. So, my friends, I encourage you to take charge of your health today. Keep a detailed list of your medications. Stay alert to changes in how you feel, and foster open conversations with your healthcare team. Your well-being depends on it. If you found this story helpful, please like this video and subscribe to Senior Moments Matt for more insights tailored just for you. I'd love to hear your thoughts. Please share your experiences or questions in the comments below. Together, we can build a community where we support and learn from each other every step of the way. Thank you for watching, and remember, you're never alone on this journey. Dr. Richard Hayes.